The healthcare landscape is in constant motion. For 2025, the Centers for Medicare and Medicaid Services, or CMS, has rolled out significant updates. These changes touch nearly every aspect of how healthcare providers are paid. Understanding these shifts is crucial for the financial health of practices and hospitals. More importantly, it impacts how patient care is delivered across the nation. These adjustments reflect ongoing efforts to manage costs and improve quality. Medicare is a cornerstone of the American healthcare system, providing coverage for tens of millions. Its payment policies often set the standard for private insurers. Therefore, changes in Medicare reimbursement ripple throughout the entire industry. For healthcare professionals, staying ahead of these updates is paramount. The 2025 updates continue a trend towards rewarding value over volume. They also address emerging needs in areas like mental health and remote care. This year's modifications bring a mix of challenges and opportunities. We see adjustments to core payment systems and expansions in telehealth and behavioral health. Providers must be agile to navigate this evolving environment successfully. These updates reflect national health priorities. They signal where CMS is directing resources and focus. For example, the continued emphasis on primary care and mental health services highlights recognized needs within the population. As we delve into the specifics, remember that these are not just numbers and codes. They are mechanisms designed to shape the future of healthcare delivery in the United States. One of the most watched figures each year is the Physician Fee Schedule, or PFS conversion factor. For 2025, this has been a point of considerable concern for many physicians. The finalized PFS conversion factor is $32.35, a 2.83% decrease from the 2024 rate. This reduction is primarily due to statutory budget neutrality requirements. This translates to an average payment cut of 2.93% for physicians and clinicians. However, a budget bill passed in May 2025 links the Medicare physician payment update to 75% of the Medicare Economic Index, or MEI. This is estimated as an $8.9 billion investment over 10 years. Changes are also afoot in the Inpatient Prospective Payment System, or IPPS, particularly concerning Medicare Advantage, or MA, claims. The Outpatient Prospective Payment System, or OPPS, is seeing an expansion of site-neutral payments. CMS is working to ensure that Medicare pays similar amounts for the same clinical services, regardless of where they are performed. Hospitals argue this could impact their ability to cover higher overhead costs associated with hospital-based care. Telehealth has proven to be an indispensable tool in modern medicine. Medicare will continue to pay for many telehealth services at least through December 31, 2025. However, many of the broad flexibilities implemented during the COVID-19 public health emergency were set to expire on March 31, 2025. Congress would need to take further action to extend these specific waivers beyond that date. Teaching physicians are now permitted to be present virtually using real-time two-way audio-video technology for services involving residents. Distant site practitioners providing telehealth services can now use their current practice location instead of their home address on Medicare enrollment forms and in claims. Broader coverage for audio-only telehealth services has also been implemented. The expansion of behavioral health services is another critical area of focus for CMS in 2025. Medicare coverage is notably expanding for services provided by peer support specialists. The shift from fee-for-service to value-based care continues to gain momentum in 2025. CMS is expanding programs designed to reward healthcare providers for the quality and efficiency of care they deliver. Programs such as Accountable Care Organization, Realizing Equity, Access and Community Health, the Home Health Value-Based Purchasing Model, and Primary Care First are all seeing continued growth and refinement. Within the Quality Payment Program, updates aim to improve the accuracy of quality reporting and reduce the administrative burden on clinicians. A key development here is the introduction and expansion of MIPS value pathways. Primary care is receiving specific attention with new initiatives. For 2025, new healthcare common procedure coding system codes have been introduced for advanced primary care management services. Another innovative step is the establishment of new billing codes for caregiver training services. These primary care initiatives underscore a commitment to strengthening comprehensive person-centered care. The 2025 Medicare Reimbursement Updates present a complex web of changes. Healthcare providers and billing professionals must take proactive steps to adapt. First, thoroughly review the specifics of the Physician Fee Schedule, IPPS and OPPS Final Rules. Pay close attention to how the conversion factor changes and site-neutral payment policies might impact your specific services and revenue. It is also critical to identify which new codes, like those for APCM or caregiver training, are relevant to your practice and patient population. Evaluate your practice's participation in telehealth. Update your telehealth workflows and patient communication accordingly. Explore the expanded opportunities in behavioral health. Embrace the continued shift towards value-based care. Ongoing education and advocacy are crucial. Stay informed through resources from CMS, professional associations, and reputable healthcare news outlets.